morning and welcome to Our Issues Milwaukee. I'm your host, Andrea Williams. During this half hour, we're going to focus on your health. Needless to say, cases and deaths continue to rise across the country, and our goal is always to provide you with information that can help you and your family cope with the effects of this pandemic. My first guest is Dr. Veneshia McKinney-Whitson. She's the Director of Maternity Care and Associate Program Director of the All Saints Family Medicine Residency Program. And she's also an Assistant Professor at the Medical College of Wisconsin. How are you, Doctor?
Good morning. Thank you so much for having me.
I appreciate you being here, and I know you are so busy, so we thank you for your time. And I actually invited you here today because last month, the Centers for Disease Control and Prevention, they announced the results of 2 new studies related to COVID-19 and pregnant women. So they said the first study, they observed women with COVID-19 and found pregnant women were at higher risk for severe COVID-19 symptoms than women who were not pregnant. And the second study concluded that pregnant women with COVID-19 were at higher risk to deliver prematurely. Give us your thoughts on that.
Yeah, the thing that's so crazy about COVID is when it first came out, we didn't know a lot about it. It was kind of like a learning, we were learning as the disease was progressing. And so initially, in that risk of people that are at risk for COVID-19, pregnancy wasn't on there. We thought maybe because anytime that you're pregnant, it almost makes you immunocompromised to some degree because you have something that's inside of you growing. And so at first, when COVID hit, we thought, okay, pregnant women might be at risk, but it wasn't like a for sure thing. And so having these 2 new studies come out saying that, if you compare non-pregnant women and pregnant women are more likely to have severe COVID symptoms. And then add to that, the second study showing that they're at risk for preterm deliveries or preterm births. So definitely that is some new information that is important. And it's important for us to get it out there to the public because, initially when it first started, we were saying you're probably not at risk. Just follow all of the regular recommendations that we've been giving you. But now knowing that they're not only at risk for their own health, but their baby is at risk for being born early is good information for people to know so that they can make the right decision to protect themselves as well as their unborn fetus.
Absolutely. And while the overall risk for developing COVID-19 is low for young, healthy women, whether pregnant or not, there are some simple safety precautions that need to be taken to reduce the risk even further, right? So when you say protect yourself as a pregnant woman, what are some of the things that they need to keep in mind?
Yeah, so for sure, the 6 feet, social distancing, wearing your mask. And when I say wear your mask, that means not just over your mouth, but your nose and your mouth. Like I have a lot of patients that come into the office and they're talking to me and they feel like I got to take my mask down, but really protecting yourself. So that means wearing your mask over your nose and your mouth. That means washing your hands and not that quick, rinse that we sometimes do, but the actual like soaping it up, getting all of your fingers, including your thumbs, your nails, especially women that have like long fingernails, making sure you're getting under those nails and really washing. With my kids out, we talk about, wash your hands and say your ABC. So, it's a teaching tool as well as is a way to stay safe. Having hand sanitizer on you. So, anytime that you think about, oh man, I should wash my hands, that's when you should do it. Especially when you go into the bathroom, when you leave in the bathroom, when you're preparing, before you eat, after you eat, anytime that you can think about washing your hands, it's important to do that. So cleaning your house, keeping everything clean. We know that COVID can stay on surfaces for a long period of time, especially with all the boxes. Everybody this year is not doing the shopping, but we're getting all these boxes sent to our house, which means, a lot of hands probably touch those boxes and COVID can stay on cardboard for a long period of time. At one point in time, we were saying 3 to 4 days, maybe more like 2 to 3 days. So making sure, like you're Lysoling your house, you're washing it down, keeping it nice and sanitized. eating healthy, right? Because when you're pregnant, we always think, well, you should eat for two. Not necessarily, because most of the time, American diet, we're already eating for two, right? So, just making sure you're eating a very healthy diet that's very balanced, includes meats, vegetables, proteins, nuts, grains, fruits and vegetables. We sometimes think about the fruit, but we want to leave the vegetables off our plate. So increasing those vegetables. And then water. When you're pregnant, you should be drinking like 8 glasses of water. So that's like 64 ounces. That's minimal. Just because you're growing a new person inside of you're going to need extra fluid. You don't want to be dehydrated. So water, water, water. Trying to stay away from like a lot of the sugary drinks. But if you still want the fizz, like I love soda, right? I love Sprite, even though I shouldn't be drinking Sprite. So I got a soda stream where it's able to fizz the water just for you to get that little tingle that you might need.
Like the carbonated water.
Yeah, the carbonated water, exactly. And then, the other thing is for women and pregnant women is making sure that you show up for the visits. I know it's so scary, like this pandemic has hit and really changed our way of thinking, the way that our world works, the way that we go to the doctor. I mean, the doctor is a place where you usually go for help, but now people are thinking, oh, should I go to the doctor?
Right.
Because is it going to be other people that's sick there? Is it going to be somebody in the waiting room? And I would say for pregnant women, we definitely, a lot of doctor's office, physician office, we have definitely taken that into consideration. So hopefully you're not going to be in a lobby with a lot of people. We are going to be wearing our mask. Like we've trained a lot of our staff in the office to protect themselves, but not only to protect themselves, but to protect the pregnant patient. So going to those visits, and I always tell my pregnant patients, if it's something that you feel like I can do, or is it something that's going on, share it with me. Because if you have a lot of anxiety, maybe we can do a virtual visit, meaning you wouldn't have to necessarily come in, and maybe it might be that time during the pregnancy where I don't necessarily need to lay hands on you. But it's sometimes you do have to come in, because I want to be able to hear the fetal heart tone and make sure your baby is moving appropriately. And we already know you're at risk being pregnant for getting COVID, but I want to make sure I can decrease that risk by us taking really good care of you during the pregnancy.
Yeah. Well, that's all great information. And the thing is, there's a lot of things that people who are not pregnant can definitely keep in mind to do as well. But before we run out of time, Doctor, I wanted to ask you, because there's so much focus being put on the vaccine, and when it does become readily available for us all, which we know that might be fall 2021, but are they going to probably recommend pregnant women be vaccinated, or do they have to still study for side effects?
Yeah, so that's a great question. So the vaccine is 2 companies that we know is going to go up to review, I think tomorrow, actually December, to go up in front of the FDA and talk about their vaccine and the side effects and efficacy of it. The thing about all of the studies that have been done around those vaccines is that it didn't include pregnant women. Okay, so with that being said, it makes sense, because as a pregnant woman, do you want to sign up to be a part of a trial and you don't know what could happen? Or, so a lot of times when it comes to these studies, pregnant women are left out as well as children. And so that's hard. But we know, like just with the flu, same thing as the flu vaccine. The flu vaccine wasn't necessarily studied with a lot of pregnant women, but we know that is a vaccine that is beneficial in pregnancy, because like COVID, getting influenza can actually kill women in pregnancy. So we do push the flu vaccine. So COVID, it's going to be rolled out for people that are not pregnant, that are like older, and it's going to be during, depending on their risk. But when it comes to pregnant women, that's like, we still need some more trials done for it to be like, yes, you need to get it. But I definitely have some like healthcare providers that could possibly get the vaccine if it's approved and then when it's rolled out that are pregnant, and they're still choosing to do it even though those studies haven't been done.
Well, I'm so sorry to cut you off. We have quickly run out of time, but
Okay.
I appreciate all the great information, and we're hoping that people are able to take this and use it for themselves or share it with someone that they know. So thank you again for your time today.
Thank you so much. You guys have a great day.
You do the same. Dr. Veneshia McKinney-Whitson. She's the Director of Maternity Care and Associate Program Director of the All Saints Family Medicine Residency Program. She's also an assistant professor at the Medical College of Wisconsin. When we return to Our Issues Milwaukee, we'll discuss the increased need for food in our community and tell you how you or someone you know can receive free food just in time for the holidays. We'll talk to representatives from Feeding America Eastern Wisconsin and Milwaukee Health Services Incorporated about their holiday dinner giveaway. We'll do that right after this.